Did you know that abdominal pain is a common complaint that people go to the emergency room for to have evaluated? And I wanted to take this opportunity to make a series of videos outlining abdominal pain and what to expect when you go to the emergency room, what the symptoms could mean, what type of testing you would have done, what type of treatment you may have done as well. So this first video today is going to be entitled Abdominal Pain, What to Expect in the Emergency Room, just a general overview or part one. And then there's going to be other parts to this series as well. So make sure you check those out on my channel as well, just to get that information also, because I'm going to be covering different areas of the abdomen after today's video to discuss if you have discomfort in those areas, what it could be. I'm going to give you some very general overview today, but then in future parts to this series, I'll get into a little bit more detail on what it could be and the testing and the treatment as well. But first, my name is Andre Huey, and I am a physician assistant. I work in the emergency room taking care of patients, and I've done this for many years. And I have a really good working knowledge of the emergency room environment, how to evaluate a patient in the ER, and also how to take care of a patient in the emergency room environment. And I make these videos for you on this channel for folks to really develop a good, healthy understanding and knowledge of that environment, to give you a good foundation to build off of and to learn from. That way, if you do find yourself in the emergency room as a patient, or if you're there with a family member or a friend, you will have seen these videos, and then all of the stuff that goes on in a busy, crazy, overwhelming emergency room may not be as intimidating and as overwhelming as it would have been had you not seen these. So today's video is simply abdominal pain, what to expect in the emergency room, and I'm going to be covering from the initial evaluation to potential treatments for your symptoms and potential testing as well, and what a few of the areas of pain could be. And again, I'll discuss further in other videos a little bit more detail as well. But for right now, let's jump into this video. So you go to the emergency room, all right? You have abdominal pain, and it's been going on for 2 days, and you need some help. It's after hours, your primary care doctor office is closed, urgent care is closed, so you decide to go to the emergency room because you have had enough and you need some answers. You feel too bad. You have checked in the lobby. They've put you into the electronic medical record. They've gotten all your triage stuff down. You've waited a little bit in the lobby, and now you're in the treatment room, and your nurse who works in that area has already gotten you in a gown. You're already on the exam bed, and he or she is getting you hooked up to the heart monitors, and they've already started an IV in your arm in preparation for the medical provider to order fluids, probably pain or nausea medicine, because you look really uncomfortable. You've rated your pain as severe, and you've had some vomiting with your symptoms. So your nurse, being very well trained, which they are in the emergency room and other places as well, know really ahead of time more than likely what you're going to need, which is those things I mentioned earlier: IV fluids, pain medicine, and nausea medicine as well. The nurse also during this time will have talked to you further about your symptoms and put a little bit more information into your electronic medical record while he or she is waiting on the medical provider to come and see you. Now, in other videos I've discussed this, and be sure to check those out on my channel, but the term medical provider, that could be either a physician, which would be either a medical doctor, MD, or a DO, which is a doctor of osteopathic medicine, or it could be a physician assistant, and the abbreviation for that is PAC, physician assistant certified, like myself, or it could be a nurse practitioner, and the abbreviation for that is NP. These medical providers, you'll see one of them, they will come in, they will have already seen your complaints and your vital signs on the chart at their desk on the computer. So they will come in and they will start asking you questions about the reason you're there. They'll ask you, but because they want to hear it coming from you. Yes, it's been put into the computer and they can see what you said when you checked in and what was entered in, but they need to ask you the questions and hear from you, because sometimes there is stuff put in inadvertently that's not quite correct, or sometimes the story changes a little bit. So some idea of questions that they are going to ask you about your symptoms, and this is not only pertaining to abdominal pain, this could be pertaining to really any complaint that you have while you're in there. But for the sake of this video, we're talking about abdominal pain. So I'm going to read from my dot points here so that I can keep it straight, so bear with me. But they're going to ask you, when did the pain start? So they want to know, did it start today, 2 days ago, 3 weeks ago, 2 hours ago? So they're going to know, when did it start? How quickly, abruptly did it start? Was it a gradual onset, or was it a sudden onset, like someone punched you in the abdomen or the side or something like that? They're going to want to know, how has your appetite been since the pain started? Have you been hungry, or have you had a loss of your appetite? They're going to want to know, does the pain move? Does it radiate anywhere? Does it go from one side or the other, or does it go straight through to your back? Very important questions as well. Has it been constant since it started, or has it come and gone? Has it increased or decreased in intensity? Have you taken anything for the pain? And if so, what did you take, and did it help? They're going to ask you, have you seen anybody for this pain yet on this time? Has it happened in the past? If so, did you see anybody? Did they find out anything? Did you take anything that helped? They're going to want to know what makes the pain worse also. They're going to ask you, how severe is your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you could imagine. They're going to ask you to rate it as well for them. And then they're going to ask you, what does it feel like? Is it a burning pain? Is it aching? Is it stabbing? Is it sharp? Whatever it feels like to you is what you're going to describe to the medical provider for the answer to that question. Have you had any other symptoms with it? Any fevers, chills, nausea, vomiting, constipation, or diarrhea? Do you have any discomfort with urination? For women, are you having any vaginal discharge at all? Are you pregnant? Could you be pregnant? Are you having any abnormal vaginal bleeding? They're going to want to know, have you seen any blood when you have a bowel movement? Or if you've vomited, have you seen any blood when you throw up? So those are going to be the questions that they ask you about your symptoms and the reason that you're there. And then they're going to move to the examination. They may be doing both of these, the interview and exam, at the same time. Sometimes that is very well possible, and it saves time to go ahead and get your treatment started. So they're going to be looking at you as they're talking to you. They're going to be looking at your facial expressions. That tells us a lot about how much pain you're in. They're going to have already looked at your vital signs. Is your blood pressure elevated? Is your heart rate elevated, or is it low? That tells us a lot as well about what potentially could be going on in the condition at that time when you checked in. If you were hurting a lot, or if you appeared comfortable. They're going to listen to your heart sounds. We're going to listen to your lungs. We're going to put our stethoscope on your abdomen, and we're going to listen to your bowel sounds as well. We also have to examine with our hands. So we're going to put our hands in your abdomen, and we're going to feel, where does it hurt? Is it soft? Is your abdomen really hard? Do you grimace? Do you make a facial expression when we touch your abdomen, which tells us that you're really, really hurting bad when we touch a certain area? Sometimes, especially with women, and if you're having urinary symptoms, we may have you lean forward, and we may percuss with this part of our fist, just tap up and down your back over your kidneys to see if that causes some discomfort, to lead us to believe, if it did, that maybe it's a kidney issue. We're also going to want to look at the skin of your abdomen to see if there's a rash there. Sometimes people can have a rash called shingles or zoster, which can cause abdominal pain as well. In addition to looking for a rash, when we look at your abdomen, it's uncovered, we can tell, do you have any signs of a hernia also? Do you have any bruising if there's been an injury? If it's a car accident, maybe a seatbelt sign or something like that, bruising or abrasions across the abdomen from the seatbelt, which gives us an indication of how severe the accident was and how badly you're hurt. Once we've gotten the information from the interview and the exam, then we're going to put in orders, which more than likely we're going to order blood counts, CBC, chemistries, which is a CMP or a complete metabolic profile, maybe an amylase or lipase to look at your pancreas, order a urinalysis and a urine pregnancy if you're a female of childbearing age. That complete metabolic count also, in addition to looking at your electrolytes, it looks at your kidney functions and also your liver enzymes also. If we're suspicious enough and you have a certain risk profile and you're of a certain age, we may also add heart enzymes, troponins, to your blood work to make sure that you're not having a heart issue that's making you hurt in your abdomen as well. We'll probably order or could order some stool samples to look for blood or infection in your stool if you're having diarrhea. And we could, if we're suspicious for something called colitis or inflammatory bowel disease, we could look for inflammatory markers. Again, all this really depends on what your symptoms are, how long they've been going on, and how severe they are, and what your past history is as well. So not all of this is going to be ordered on every patient who comes in with abdominal pain. Now, some of the imaging that we would order, x-rays, a plain x-ray possibly. More than likely though, you're going to get a CT scan, sometimes with contrast, sometimes without. I would say more times with contrast, and that would be typically IV contrast. Although if you have had some sort of bariatric surgery for your weight, then you could possibly get IV contrast and oral contrast if you can tolerate it as well. Sometimes if we're looking for kidney stones, you'll get a CT without contrast, or if you're allergic to the contrast, then you'll get a CT without. You could have an ultrasound ordered of your abdomen to look for such things as possibly your gallbladder, for inflamed gallbladder or gallstones. Some of the medicines that we may order to treat your symptoms, typically you'll get some IV fluids. Sometimes you'll get a bolus, which is maybe a whole bag ran in pretty quickly, and then a maintenance to just run in slowly while you're there, just to make sure you stay hydrated. If you're nauseated or if you've had vomiting, you'll maybe get a medicine called Zofran or ondansetron IV, which helps with nausea, vomiting. There's some other options as well, but for the sake of this video, trying to keep it simple and just giving you some ideas. If we're thinking maybe you have inflammation in your stomach or an ulcer, we may give you something called famotidine or Pepcid IV to help reduce the acid, which will give you some comfort as well. Sometimes you can tolerate getting a medicine by mouth, maybe some Tylenol. Other times you may need an IV dose of pain medicine. And most of the ones that are going to help you if you're in severe pain is going to be a narcotic pain medicine. And your medical provider, when they order these medicines, they'll talk to you about that. And also the nurses will talk to you about it, and they'll tell you what you're getting. So I'm not going to get into a lot of specifics about that. Again, it's really up to why you're there, how severe you're hurting, and then also what your medical provider has ordered for you to have. So that's what to expect when you go to the emergency room. Very briefly, to keep it simple, for abdominal pain. Now, this is the first video of a multi-part series where I'm going to dive in and look at different areas of your abdomen and what could potentially be going on when you're hurting or have discomfort in those areas. I'm going to do that on future videos. So make sure you go to my channel, subscribe, and look for those videos in the other series as well. Those are going to be coming really soon. Again, thank you for watching this video, for watching until the end. Please subscribe to this channel, and I would love it if you would like and share this video with your family, your friends, and your coworkers as well. Also, please drop a comment in the comment section and let me know, have you had an emergency room experience and how was it? Please be generic. Don't put any names. Don't be specific about where you went or what the problem was. Just let me know. How about if you had seen this video before you went to the emergency room? Would it have been a little bit of a help for you? Also, there'll be some links above for other videos that I've made, so check those out also. I look forward to seeing you on the next video. Thank you so much for watching. Take care.